Hot flashes, brain fog, and stubborn belly fat, plus those mood swings that nobody can stand in your house. Then you go to your doctor, he tell you, yeah, it's probably menopause, but you will have to deal with it because there's nothing we can do about it. Well, you've been lied to. Hi, I'm Dr. Sophia Fels. I'm a board certified family medicine physician, holistic mom of three, and wife. And I'm someone who's walked alongside hundreds of women through this stage of their life. And in this video, I'm going to show you my 6-step process on how I'm going to help you thrive in menopause. The first thing that I need you to know is that science shows that menopause does not equal suffering. And let me explain why. And what can you do about it? Just by watching this video till to the end, because my last tip is super important. So when we enter perimenopause and menopause, estrogen and progesterone drop dramatically, right? You were having high levels, especially during pregnancy, and all of a sudden, they start like poof and disappear. Now, these hormones aren't just about fertility. They touch everything in your body, your brain, your bones, your heart, your metabolism, and even your mood. That's why you get so moody. So when estrogen falls, you will show signs of hot flashes, anxiety, and bone loss. That's why women after menopause, they start having osteoporosis, weak bones. Then when the progesterone drops, you will show signs of irritability, restless nights, difficulty sleeping, or feeling of being on the edge all the time. And here's what most women do not realize. If you have stress hormones like cortisol, blood sugar hormones like insulin, and they're already off balance, this transition will hit you even much harder. And that's why it feels like your whole body is in rebellion at once, like your body is attacking you and you don't even know who you are anymore. Think about it. Hot flashes at 3 a.m., waking up drenched in sweat, dragging through the day in a fog, feeling a snappy 1 minute to the next, and then watching the scale climb even though you haven't changed a thing. You haven't changed your diet, your exercise pattern, everything is the same. So maybe you even notice your heart racing, your joints are aching, your intimacy becomes painful, and you don't even know what is going on in your body anymore. It's just random. It's not in your head. It's your body telling you there is a major hormonal shift happening. And in integrative medicine, with a holistic approach, we just don't say, well, you're getting older, deal with it. Because to be honest, that's not fair to all the women out there that are undergoing this process. So I asked myself, why are these symptoms so intense in certain women and in others are not? And here's what I see again and again with hundreds of my patients that have gone through this process. First of all, for gut health, about 70% of estrogen detox happens in your gut. So if your microbiome is off, is going to get having problems recycling your estrogen, and then your symptoms are going to flare up. If you're going to have a lot of stress, decades of being on everything leaves cortisol sky high. That stress hormone makes hot flashes, poor sleep, and even a belly fat worse. Then your blood sugar. Midlife is when insulin resistance creeps in. We see that A1Cs start slowly creeping up. That means more cravings, weight gain, and crashes. You're going to feel like you don't have any energy in the afternoon. Lots of women will have nutrient gaps, and that means that if we test you, you're going to be low in magnesium, in vitamin D, in omega-3s, all of which your body needs for hormone balance. Now, there is the good news, right? Small daily shifts can actually help your body rebalance, right? So what are the things that I actually advise my patients who are undergoing menopause? Let me give you a roadmap. This is my 6-step to thriving in menopause. First of all, we want to balance the blood sugar. It means you're going to pair your protein with fiber, healthy fats at every meal. You're going to swap the sugary cereal for eggs with avocado, and you will feel steady instead of crashing 2 hours later. Then, for step number 2, you want to calm your cortisol. You want to reduce that fight or flight that usually keeps the cortisol high. So what we're going to do is daily movement like walking, strength training, or deep breathing so that you're slowing down your nervous system. You're going to add praying, journaling, even deep breathing. These are not luxurious, they're just medicine. They're gonna help you rebalance and calm your nervous system. Third, you're gonna support your gut. You're gonna add fiber. You're gonna add fermented foods like yogurt, like sauerkraut. You're gonna populate with colorful vegetables. And the more diverse is your gut, the smoother your estrogen balance. Number four, you're gonna protect your sleep. Sleep is super important, right? 7 to 9 hours is non-negotiable. You're gonna dim the light, you're gonna shut the screen, you're gonna add some magnesium glycinate at night that can help your body truly reset and feel less stress at night. Number five, you're gonna feel the nutrient guides. It's really important that you add omega-3s for mood and decrease inflammation, vitamin D for bones and hormone health, and gentle herbals like black cohosh or ashwagandha. But you always want to ask your physician first if it's okay to take these supplements. Number six, bioidentical hormone replacement therapy. This is major because if this is right for you, sometimes just lifestyle alone isn't enough, and that is okay. Stradiol patches can calm the whole fascias and protect your bones. Micronized progesterone can actually restore deeper sleep and give you much steady mood. A topical estrogen gel or DHA can heal vaginal dryness and even reduce the risk and the chronicity of UTIs. This isn't the scary old HRT from decades ago. We're talking about bioidentical hormones that started at the right time under supervision of a clinician or physician who has experience, can be safe, effective, and life restoring. So here is what I want you to remember. Menopause isn't the end of your health. It is a transition. And with the right tools, you can feel stronger, clear, and even more vibrant than before. Again, your body isn't broken. It just needs the right support. If this spoke to you, make sure that you hit subscribe and follow me for more science-backed integrative tips to help you thrive in midlife and beyond.